Dr. Plano, and we're going to discuss in this page what a labiaplasty is. A labiaplasty is removal of redundant skin in the labia minora. And just like half our body is asymmetrical, it's the same thing in that area also. The labia minora might be larger on one side than the other, and there's all sorts of reasons. A lot of it is just genetics. Having children, all that contributes to the labia being hypertrophied. So the surgery involves removal of that excess redundant loose skin. So it's not only a cosmetic surgery where we actually rejuvenate that area of the labia minora, but it also, for some patients, will help with some of their symptoms if they're having painful intercourse. There are two main surgeries performed for a labiaplasty for reduction of the labia minora. And one is a classic just excising the tissue, and the other is a wedge excision. And so a lot of patients with hyperpigmentation, just excising that tissue is probably the best option. And if someone wants a more natural looking labia that's a lot smaller, that's where the wedge excision comes into play. So every option, these are discussed during our consultation, and that's why an examination is crucial to see what is the best option for the patient. Some of our patients who are weight loss patients also have loose skin along the labia majora, which is right next door to the labia minora. And treatments for that is a skin excision if needed. And a lot of times we just add what's been reduced with weight loss, which is volume. And so just like we have facial atrophy as we get older and with weight loss, it's the same thing with the private area. So we'll do a little bit of fat transfer into the labia majora as a treatment for that area. The downtime for this surgery, most people, will take a week off of work. After the initial surgery, you're applying ice in the first 24 hours. You have to wear loose-fitting underwears that apply a little bit of pressure in that perineum area. So nothing thin, just more of a wide underwears that apply a little bit of pressure along that perineal private area. If someone has a physical job and they're working and they're on their feet, most people, I would definitely recommend taking 10 days or 2 weeks off of work for that. And you can read more about our labiaplasty procedure if you scroll down on our page. And you can see a lot of before and afters. Thank you.